Good afternoon, everybody. Thank you all so much for being here today. I'm very excited to welcome Tanis Stevenson. She is a registered nurse. She is a business owner. She started her own business related to compression stockings. It's called Northern Entity. She started that about 1 year ago. So we're going to welcome her today. She's going to chat with us and tell us a little bit more about compression therapy and stockings and how that relates to older adults and our health in the community. So I'm going to give it away to her, and let's all give her a big round of applause. Before we start our clapping, I just want to quickly note that Tanis is going to go through her entire presentation. If you guys think of any questions that you want to ask, feel free to type them in Q&A or in the chat box. We will field questions at the end about the last 10 to 15 minutes of the presentation, and I will be sure to look at that chat box. But now join me in a big warm welcome for Tanis Stevenson. Hi, Tanis.
Hello. Thanks everyone for being here on this beautiful afternoon. Yeah, we're just going to go a little bit, like she said, we're going to go over kind of compression stocking therapy, but also just going over a little bit of how they work and a little bit of anatomy at the beginning so you have a better understanding. And then, like she said, I'll answer any questions at the end. This is one of my first Zoom presentations, so bear with me. But yeah, so sorry, my partner Juliet can't be with me today, so it's just me. But her and I, about a year ago, started a compression stocking business. Her and I are both registered nurses on our feet for long periods of time, and we were just seeing a lot of whether it was our coworkers coming to work with varicose veins, or our patients that ended up with deep vein thrombosis that traveled and call it pulmonary embolisms. We just saw that there was a lot of need and there wasn't a lot of access or people who knew about compression stockings or didn't know how to get fitted properly for it, which is a big part of it. And so we kind of started this business about a year ago, and we're just kind of doing some different avenues of that. Like I said, there's just going to be a little bit of anatomy at the beginning, and then just how that they work. So yeah, we'll just get started here. So quick anatomy review, how the blood pumps, the difference between arteries and veins, chronic venous diseases, edema, varicose veins, the DVTs and PEs, and the risk factors, prevention and recognition, compression stockings, and then level of compressions. Sometimes that can be confusing for people of what should I be wearing for what purposes, and it's all very individualized. So we'll go over a little bit so you have a brief overview of what that is. And then we'll talk a little bit about what Northern Entity does in case you do feel that compression stockings might have a benefit for you in your life. So the circulatory system, just a little bit of review. So when the blood pumps, blood moves through the circulatory system. So it leaves the heart through the arteries full of oxygen. So the arteries branch off into smaller and smaller tubes and bringing the oxygen and nutrients to the cells of the bodies, the tissues and the organs. They go through capillaries and then they move back through the capillaries. The oxygen has been delivered to the cells, and then the capillaries go up through the veins back to the heart, where it goes back through the lungs and to back to the heart, and then to the system, to the circulatory system. Is generally how blood flows. Blood flows away from the heart in arteries. So arteries, I guess the difference between arteries and veins, there's a couple of really big differences. So arteries are really thick vessels that have no valves. And so they move blood basically by the heart pumping and the flow of the pressure from the heart pushing the blood through. So they have these kind of thick walls that hold the blood in place. Where the veins on the other side are a lot thinner walled and they have valves. And so if you think of it, they come through, and these valves, when your vessels are healthy and the right size, the valves kind of open and close. As those if those veins have lots of pressure in them, uh, then they'll start to expand, and then these valves can't quite close. So there's lots of other differences between artery and valves, but for the importance of compression stockings and for understanding it, if you just remember that the arteries flow because of the heart muscle pumping through, and then these kind of thick walled vessels, and then the veins having these thin walls, and they flow back with a pump that we'll talk about here shortly. So how does blood return to the heart? So you have this thin-walled vessel, and so what's causing, with a bunch of valves, and so what's causing it to return to the heart is your big muscles. Usually we'll talk a lot about calf muscles because that's kind of one of the bigger ones, and a place where a lot of people get the clots is in the calf muscle and in the back of the leg. And so basically what happens is your calf will squeeze, it'll squeeze this compartment, and then blood will flow from one compartment, the diameter will narrow, blood will flow up through one compartment into the next one, and then you have these nice valves preventing backflow. And then it's just a continuous motion. So when you're walking, it'll just continue to do this, and then blood will flow in that manner. So when we walk, the muscles repeatedly contract and relax, and every time these muscles contract, they compress the veins in the deep system, promoting blood transport towards the heart. If the muscle pump is at rest and the pressure in the veins is reduced, it creates this backflow, and the blood will kind of flow and kind of sit in those vessels. And that causes some problems. And so there's a lot of chronic venous diseases. So we'll talk a little bit about chronic venous diseases, and then we'll talk about acute venous diseases, because those are the ones that can kind of get you into trouble. But there's definitely different levels, and you've probably either seen some of these on yourself or seen them in general. But these spider veins or reticular veins, these are really small, dilated, superficial veins that are less than 1 centimeter or 1 millimeter in caliber. They're really little. They're not causing a whole lot of harm, other than they're kind of giving you a sense that there is starting to be a little bit of disease forming. But generally, they're not going to cause harm, other than they maybe don't look as nice. And then the next one is varicose veins. So varicose veins are dilated. They're up to 3 millimeters in diameter or larger. And these are when you're starting to see these defective veins causing venous stasis. They can be found in the foot, calf, thigh, up the entire legs. And they have some symptoms associated with them. So they can cause some ankle or leg swelling, some heaviness or fullness, aching, restlessness, fatigue, pain, cramps, or itching. And they can actually bleed, unfortunately. So some of the causes for developing veins are those who are at risk, or anyone over the age of 50, if you're kind of working for long times, sitting or standing, any physical inactivity, obesity, it can be hereditary, and then with pregnancy and menopause also start to put you a little bit more risk for these varicose veins. So I did say that they can bleed. It's not very common, but they can bleed. And if that was to happen, what you just want to do is, again, they're just kind of more likely to rupture. But to stop the bleeding, you just would want to elevate that leg, apply some constant pressure. And then if it doesn't stop bleeding, then you can seek medical advice. But usually just a bit of pressure and elevation should be enough to form a clot and stop that bleed there. The next kind of chronic venous disease is edema, which is an increase in volume of fluid in skin and subcutaneous tissue. And it's one of those, if you kind of put your finger, if you think you have some swelling, you put your finger there, you move your finger out and you still see an indentation. That's called pitting edema. And that usually, again, happens kind of, gravity is not our friend, so that's usually happening in the lower ankles, calves area, but that can happen anywhere. And it's caused by when blood stagnates in the veins. It's preventing the capillaries from properly functioning, causing excessive fluid. So your fluids intravascularly will then start to kind of weep extravascularly, and that's where you'll start to see that. So again, that can be caused by standing or sitting for long periods of time, any physical inactivity, chronic venous disease, or sorry, lymphedema. It's also hereditary, pregnancy, surgery, and trauma also puts you kind of at risk for some edema. Pigmentation is kind of a brownish darkening of the skin due to leakage of the red blood cells from the vein into the surrounding tissues. Again, usually in the ankle. Not necessarily a harm, but it's just, again, telling you that things are going on, just to be mindful of it. And then we're going to just talk a little bit. I kind of spend a little bit more time on these because the chronic venous, you can talk to your doctor, you can get some things for prevention. But the acute venous disorders are ones that kind of sneak up on people and actually have some pretty life-threatening implications to them. So we'll talk about a DVT because it'll lead into pulmonary embolus. So a deep vein thrombosis is basically a clot that forms usually in the lower, kind of behind the knee or in your calf, and you'll have symptoms of kind of, this can be progressive. Some people are completely asymptomatic with it or don't have any symptoms at all. But if you have some leg swelling, leg pain or cramping or soreness that starts in the calf, a change in color of the leg, so like if you start to get like red or purple, a feeling of warmth in the affected leg, and you'll notice kind of one leg bigger than the other one. It just might be, and no other kind of suggestions of why this would be. You would want to be worried about potentially that being a deep vein thrombosis without, and so that's something that you'd want to contact your healthcare provider. You don't need to necessarily call an ambulance to take you in, but it's definitely something you want to get checked out. If you notice kind of one of those legs is a little bit painful or swollen or a redness or a different size, that would be a good thing just to talk to your doctor about, and just get checked out. They would maybe do an ultrasound, just to, if they did suspect there was a deep vein thrombosis, and obviously a history would help, but that would be something that maybe an ultrasound, if it is a suspicion, if you've had DVTs in the past, if you have any sort of clotting condition or a reason to think, whether it's an injury or something that there might be, or if you're kind of bed rested. So that would be something that if you're at home, something to talk to your healthcare provider about. Not something to kind of ignore long-term. Risk factors for a DVT is just, again, age over 60, lack of movement. So flying and driving long distance, we see a lot of people, of truck drivers actually, who just are just sitting long periods of time, or even young people that are just on a long flight and they don't want to disturb whoever they're sitting next to. So they just sit there for 10 hours on a flight. Bed rest, injury or surgery puts you at higher risk. Pregnancy always puts you at high risk for everything, but also oral contraceptives or hormone replacement therapy. Overweight or obesity, smoking, cancer, heart failure, or inflammatory heart disease like Crohn's or ulcerative colitis, as well as a family history or genetics. And it's possible that you have none of these and to get it unprovoked. So just for no real reason, but those are a lot more rare, but something to be aware of, that it's possible to get one without all of that, any of that risk factors as well.
Janice, how often do you see something like that happen where it's completely unprovoked?
Not very often. Yeah, it's usually associated with something, and then usually it's not often, and then usually there's an investigation of why that happened, and whether it's like cancer screening or follow up or whatnot. It's pretty rare, but we have seen it even with like young people on oral contraceptives trying to do the right thing. But yeah, it doesn't. And I mean, my view might be skewed because we see the worst of it, but it does happen. We do see it with just either one of those risk factors. But it can be unprovoked, but it's definitely usually you have one or more of these risk factors. But yeah.
Thank you.
And in DVT prevention, the first thing you can do is move your legs. So if you're not moving, if you're not causing that calf muscle to contract, basically what's happening is your blood is just, there's nothing moving that blood forward. Your blood is stagnant. Your little platelets are all have the time to to attach to each other, and that's how that clot forms. So the best thing you can do above compression stockings, above everything, is just to actually move your legs. So if you're on a long flight and you're sitting there, get up every hour, hour and a half, get up and move. If you can't do that, even just doing some calf legs, do anything that's kind of causing contraction of that calf muscle to get that blood flow moving, so it's not just sitting there and then clotting. If you're smoking, it's a good time to quit. Manage weight. Again, obesity is a risk factor. I realize that that's very easy for me to say for both of those factors. It's challenging for sure, but those are some things that you can kind of focus on. And then when appropriate, wear the compression stockings. So if you're going on a long flight or you're going to be traveling, it's a good thing to add that in as well as moving your legs there. So the problem with a DVT, so if you get a DVT and you got it diagnosed, you can be on a blood thinner or tinzaparin. So the problem with a DVT, it in itself doesn't have huge implications. There can be, I mean, you can have post-DVT pain and whatnot, but the real concern is that a DVT will travel from the deep vein thrombosis. So if you remember, from the blood travels from the heart back, or from the periphery back to the heart, and then it goes to the lungs to get oxygenated, right? So the problem is that clot will follow that same path. So it'll go from your legs, it'll go to your heart, and then it'll go to your lungs. And that's when that is a life-threatening condition. Once that clot is in the heart, then your oxygen is going to the areas, and your blood's not getting oxygenated, and it can cause cardiac arrest. It can actually kill you. So warning. So if you suspect, say you have a DVT, or if you don't, or you have sudden shortness of breath, if you have chest pain or discomfort that worsens when you take a deep breath or when you cough, if you're feeling dizzy, sudden lightheaded or dizzy, fainting, rapid pulse, rapid breathing, or coughing up blood, this isn't I'll make an appointment with my doctor in the next couple of days and see if it resolves. This is something that you need to be going to emergency right away. Again, we've seen, this is what we end up seeing in ICU, is people that are on high doses of oxygen that we are just kind of waiting to give them a clot busting drug, which is not ideal because that's going to break up any clot. So then if you have a little tiny clot in a tiny vessel in your brain, it's going to cause problems. So this is actually an emergency. And so if you start having any of these symptoms, this is something that you would want to go to emergency immediately for, and just symptoms not to ignore. So is there any questions, or did any questions come through just kind of before I go on to the next?
So there's one question at the very
Yeah,
beginning, and then during that I had a question, but I
sure.
didn't know.
Yeah,
Oh, okay,
yeah.
well I'll read Mary's first. She
Okay, Mary.
typed in the chat box there, said I would like to know more about varicose veins and itching, itching of the
Okay.
legs, and even if there's other areas of the body. Why does it get itchy? Sort of.
Yeah, that's a good question. I would, and it is quite common to get itching, and I don't know if um, I want to say it's just like a little bit of the inflammation, like as those, like the stretch sometimes can cause itching, the stretching of those vessels. But that's a good question as to the actual mechanism of it. I would imagine it's just the stretching of those vessels is an irritant and might cause that itching. Or like the stretching, if you've got the varicose veins, and like the stretching of the skin, it's just an irritating kind of feeling. But yeah, there's quite a bit of reports of the itching and it being quite irritating. And sometimes compression stockings, again, will kind of, if the itchiness is coming from the swelling of the skin, those compression stockings will kind of help reduce some of that swelling as well. But that would be my understanding, having not necessarily looked up that question, but that would be just the stretching, I would think.
Oh,
Would
I
be
think that's a good answer because I didn't even think of that. And it's like, yeah, of course, the stretching. It's like,
yeah.
when you're pregnant
Or
and your belly gets
yeah, like
bigger,
I
it
remember
gets
being
itchy.
pregnant and just everything was itchy, and it was just the stretching of the fibers and the skin definitely can
Yeah.
cause it. So it might
Oh,
be more that than the varicose veins if there's a little bit of edema with it as well, which usually there is for sure.
I love that answer. My question was like, and I don't know if you can speak any more to this, like in a layman's terms, sort of thing for
Yeah.
my benefit. But I do remember, so years ago, my stepmom, she had to have bypass surgery, and I remember visiting her in the hospital, and her leg was, it was, they were doing it all through the leg. So I just kind of wondered, it's got to be like a vein or something that goes from the left leg all the way up to the heart or something. And then you kind of mentioned that how if you're feeling this in your legs, like it can relate to your heart, and once it gets to your heart, it's kind of game over, right? So I just kind of wondered how that happens, how it comes from your leg all the way up to your heart, if that makes sense.
Yeah, so the bypass surgery is a little bit of a different. That's like if you have a blockage in your coronary arteries, and so what they do for that is that they actually they harvest a vein from your legs, and then they use that vein to kind of bypass a vessel that's atherosclerotic in your heart. So that's a little bit of a different. Those are kind of two different situations, but again, with surgery she was probably at risk for having a DVT as well, just because she's in bed. And then if you've had some of those surgery, you got a lymphatic system that also kind of runs next to and helps collect some of that extra fluid, and return that also. And so if you've had any surgery that's cutting through and getting some vessels, you're definitely at high risk for a deep vein thrombosis just because you're laying around. And then you're also at high risk for just some edema after that, just because you've probably damaged some of that lymphatic system, as they cut through your tissues as well. So did that answer your questions?
In
But
so
the
many
deep vein but the deep vein thrombosis occur kind of separately, in that there is a big clot that's moving usually from your legs, traveling up with the blood that's going, hoping to get oxygenated in the lungs, and then it just lodges itself in one of the big pulmonary arteries. Or
Okay.
yeah, yeah,
And that makes sense to me.
yeah,
Yeah. So thank you so much, Tanis.
yeah.
Um,
No worries.
we do have one more question. So we had
Okay,
somebody type in that says, I don't know if I'm pronouncing this correctly, but please, correct me. It's Ehlers-Danlos hypermobility syndrome.
okay,
And I'm obese with many other chronic conditions. And when I
yeah,
try to use compression, it tends to really hurt. And
yeah.
when I remove either the compression socks or the ankle tensors, etc., is there a trick to it?
Yeah. We'll talk a little bit about donning and doffing, like putting on and taking off at the end. It shouldn't hurt. Yeah, there shouldn't be pain. But they are tight. Like, people are kind of sometimes shocked by, and depends on what compression level you are. But unfortunately, they do need to be tight to do it, because if you're just applying a little tiny bit of pressure, it's not enough to kind of keep those vein walls intact, kind of compressed. And so they do need to be tight. And depending, especially if you've got kind of a higher compression level, they are hard. So there's like, it shouldn't cut in. So sometimes people will say that is that they put it on and then it cuts in. So those are either too tight or the wrong, like, potentially there's below knee when there needs to be above knee. So it might be a fit problem. But yeah, they can be challenging to put on and off. But I'll talk about it a little bit at the end. I'm sorry that that's happening, because that's really unfortunate. And especially with multiple comorbidities, it's definitely, they are hard to get on, or they can be hard. And so we'll talk about some tips at the end that kind of can make that a little bit easier.
Okay, thank you, Tanis. And then they also just said at many different compression levels. So that
Oh,
was
they've
just
had
an
many
addition.
different ones.
Yeah.
Yeah, yeah. Oh man, yeah, I'm sorry. That's challenging for sure. And so if that's occurring too, some other things that might be beneficial is, I'm not sure what kind of her day to day looks like, but also, if the swelling, you're kind of fighting it, those compression, I would maybe recommend even like taking some time throughout the day and letting gravity help. So if you kind of lay on your back and let the gravity help drain some of that fluid, so it's not just the compression, just to even kind of massage your legs down, just to help bring some of that fluid down, as opposed to just kind of relying solely on those compression stockings. Might help just reduce swelling, that might reduce some of that pain. But yeah, it's challenging if she's tried kind of multiple different. It might be kind of the type too. Like I find that there's some that are easier to get on and easier to get off. Some of the cotton ones are definitely easier to don than some that have some of the nylon ones. So we'll kind of go through a few of the different ones, and hope that we can give her some advice. So sorry about that.
Thank you so much, Tanis.
Yeah, so we'll just talk a little bit about how compression therapy works. So basically, the controlled pressure exerts by the medical compression stocks reduce the diameter of the major vessels, thereby increasing the velocity and volume of blood flow. So if you think that you have, like, if your vessel is normally this big, and then as you kind of stand or sit for long periods of time, the muscles not moving blood forward, so then they start to get bigger and bigger. And so what compression stockings do is they, from the outside, apply enough compression that it'll help keep those vessels a little bit narrower, so that blood can flow up and through, and the valves are able to kind of help with that. So it reduces the blood reflux and stagnation and provides better drainage of the deep venous system, which helps increase and thereby improve the circulatory rate. We talk a lot about the leg ones, but there's also ones like sleeves for your arms. If you've had, say, like a mastectomy or something and you have lymphedema to the arms, people also will wear compression therapy on their arms as well. So there's a bunch of different levels of them based on what people need. And so the lowest level of this is the 15 to 20. You can go into a grocery or into a drugstore, and these are considered over the counter. And those are just generally for people who kind of have pretty healthy legs, but kind of they're mild or achy, tired legs kind of by the end of the day. They want support for either standing or sitting for long periods of time. So they're really good for traveling long distance. They've got good recovery socks, or just when a little support is needed for general health and energy. So these ones are significantly lower in price as well. And they aren't necessarily measured to you, but they are based on your shoe size. So that might be all that some people need. But once you start having some of these more symptoms, some mildly achy or tired legs, the painful, heavy, fatigue, aching legs, if you've got some mild varicosities with minimal edema, post-venous treatment, then this 20 to 30 is a good fit for those people. They are considered medical grade, so you do need to get proper measurements for these because they are applying that more pressure. They're really good for nurses. Nurses have really good benefits. Teachers have really good benefits. And some, there are a lot more people than are aware of it. I do actually have pretty good benefits for compression stockings, but they all kind of vary a little bit. Athletes, it's good for. They're really good for after, like they've showed that they decrease soreness. So if you're going for a hike or whatnot, it's really good if you're usually stiff or sore the next day. They kind of help improve blood flow, and then they improve lactic acid clearance. And so that's generally why athletes are using them. And then they kind of get higher. So this is just in the picture is a thigh high one. So they don't go all the way up kind of to your groin, but they go kind of mid thigh. These are a 30 to 40% or millimeter compression is good for moderate to severe varicosities with mild to moderate edema, post-fracture of traumatic edema, or venous ulcers, or DVTs. If you're wearing compression stocking for a previous DVT, it needs to be above the area that you had that deep vein. So if it was in your calf area, then you could wear it below the knee. But if some people have the DVT right at the back of the knee, then you'd kind of want to wear something higher than it, because there's not going to be much improvement above where the compression stocking is. So if you've got varicose veins kind of up in your thigh, you're not going to see a whole lot of improvement if you just wear the below knee. So they do have them that go all the way pantyhose up to your waist if you are having some of those concerns of varicose veins up into your thigh there. And then 40 plus is for severe varicosities, severe edema, recurrent or active venous ulcers, and then severe post-fracture edema. So these are, I've actually never fitted anyone for these. These are for if you do have like kind of the severe disease. And you would want to probably consult with your physician before getting 40 plus, just because they are very tight. And so you want to make sure that that's what you and your doctor figured is best for you, for sure. And then we'll just talk a little about donning and doffing, because it can be challenging. My brother put on a pair and I watched him put them on, and it was a struggle watching him, and I hadn't given him much guidance. I just had fitted him and gave him a pair, and he struggled quite a bit. But the type of compression sock you wear also matters. So like I said, some of this performance, like this one is the one he was trying on, and it's quite challenging, but it has its benefits in that it has good airflow and whatnot. Some of the cotton ones are definitely easier to put on versus some of the nylon ones or some of the other ones. But the one of the most important thing is both to get measured in the morning as well as to put on compression stockings before starting your day. As soon as you kind of stand up and start walking around, and if you're prone to have that edema, it's already going to start. So kind of first thing in the morning, that's when the swelling is going to be the least, because you haven't had a whole day of gravity working against you. And so putting them on at the beginning of your day, if you're putting it on and you've been awake for a couple hours, it's not ideal. So if in that situation, you're probably better off just actually putting your feet up above your heart for a period of time, just letting gravity do some of that draining and get some of that fluid out of your legs. So I would say that's the number one to help with the donning. Make sure your legs are dry. So my brother kind of woke up with sweaty feet, and so I think that was more his problem than anything. But there's powder to make them go on smoother. So whether it's kind of just talcum powder or cornstarch, just makes it slide if your legs are either too sweaty or too dry. Sometimes if your skin's like kind of flaking, that can also be challenging. So if you put lotion on, just make sure the lotion's completely rubbed in and dry. And then if it's still kind of sticking and hard, I would definitely put some talcum powder on. And then you want to use gloves too, like especially if some of the thinner ones, it sometimes is easier to do if you're wearing some of the rubber gloves. And then you don't want to, when you put it on, you want to flip it inside out, and then you're going to pull it up. So you don't want to roll it kind of the way you do a sock. You want to kind of have it, flip it inside out, put it over your foot, and then just kind of smooth it out. If you've noticed any wrinkles in it, you don't want to just pull it at the very top, because it's most likely just going to damage the compression stockings as opposed to get the wrinkles out. So they actually can be smoothed out pretty easily as long as there's not huge wrinkles. You're better off just smoothing out the wrinkles rather than try to pull and stretch it out, because you're gonna wreck the sock. And then just take off the sock again, doing the reverse where you kind of pull it down over itself and off, as opposed to kind of rolling down or trying to pull from the toe. And then just practicing, like it is a bit of a struggle, and if you're in the right sock, it's doable. But if it's not, and you're not wearing it because it's too much of a struggle, then you might be in the wrong sock. So you might want to go back and see if there's another alternative. And then there is, do I talk about it here? No. There is some aids too, for people, whether you have like grip strength. So sometimes that can be challenging if you don't have enough grip strength to get it on. There's mobility aids if you can't reach your feet, which happens. And then this picture on the top is kind of it helps roll it on and smooth it. And sometimes that can make putting it on a lot easier as well. And there's videos online, like if you can just Google Sigvaris donning or doffing videos, and it'll give you kind of some tips and tricks as well and some guidance.
Hmm. And I just quickly interject to say that the previous person that typed in and about compression different levels, they
Yeah.
just said thanks so much, Tanis. Yes, I also try using tights with good compression and then put tensor on the outside, but too hot for me. I have many fans, and then a cry laughing face.
Oh, yeah.
Um,
And so that's too bad because that sounds probably like she needs, if she's putting tensors on to try to add, she probably would need a higher, like she's probably in a lower compression than maybe she needs to be. But if that's what's working for her, like if she can't get on the higher compression sock and that's what's working for her, um, whatever's working for her for sure, as long as it's not too tight. Like the goal is you don't want to cut off the circulate, like you want to narrow the vessels of the veins, but if you keep squeezing too hard you don't want to actually cut off blood circulation. Like you don't, for sure don't want to do artery circulation, but you don't want it too tight if you don't need it either, right?
mhm.
So as long as she's got good circulation to her toes, like does she have good capillary fills, no numbness or tingling, are the toes pink, and it's not hurting and it's working well for her, then great, that's awesome.
Oh, awesome. And then they also said rubber gloves. So you were talking about
Yeah.
little helpers kind of, and they said rubber gloves as well. So,
Make it, yeah, they definitely make a difference for some. Like some people have no challenges at all getting them on, but definitely. And then some of them are kind of pantyhose material that are more likely to rip, but it's definitely easier to get a better grip and to get them on smoother with the rubber gloves as well.
okay.
Yeah.
And then can we field a couple? I got a couple more questions, or you want me to
Yeah.
hold off on them, or okay.
Yeah. I don't know why this isn't. Yeah, I have one more slide and then just Karen, it'll be really quick and then I can answer all of the questions.
No problem.
Is
You
that
go
all right?
ahead first. Yeah.
Awesome. So just care of compression stockings. Just when you're washing them, you want to wash them inside out, just using mild detergent on a gentle cycle and then in a mesh bag if you're using the washing machine. And then when you're drying, you just want to dry flat, avoid, like you don't want to be twisting to get the fluid out or the water out. And then store in a cool, dry place. Like just don't hang it on your clothesline for in the sun for long periods of time, just because it can wreck the elastics and then it'll weaken it and impact the compression. And then a lot of people find this quite surprising and then also frustrating is that the compression actually, depending on use, like if you're wearing them every day, but generally they say if you wear them, say every single day, they usually only last 6 to 12 months. So lots of people get two pairs and then they kind of alternate. So then they last a year, a little bit longer. But we'll go to the hospital and there'll be nurses wearing it and they've got holes. I'm like, how old are these? And they'll be like 15 years. And I was like, okay, well, they're probably not doing. I mean, they're just working as regular socks because you just don't. If you've got holes in your compression socks or you've had them for multiple years, they just start to lose their compression, which is unfortunate because they are kind of an investment, but they don't last as long as I would want them to. But a lot of people don't know that. They'll just wear them till the end, the way you wear a sweater or whatever else. But they do start to lose some of their benefit if you're wearing them for years and years.
Mm, wow.
Um, yeah, and then a little bit just about Northern Entity is if you're getting them, just make sure that they fit properly. So we're a mobile clinic, so if this is something of interest to you, I've just left my email there. You can reach out to Juliet or I, and then we can get you fitted. And we've got samples that we can get you measured. Or I don't know if it's beneficial to set up a day where we could come to your facility and if there's interest in that. But yeah, it's there's other places to go to. This is more of an education than expecting a bunch of emails. But yeah, but I can answer any questions anyone else has or
Oh,
elaborate if there's more.
I love that. Thank you so much, Tanis. I do
Yeah.
want to say I really appreciate that you're like, look, this is not to get your guys' business. This is just for general education. I think
Yeah.
that in itself just makes us more want to be like, well, if I need compression stockings, I'm calling Tanis. So,
Yeah, and yeah, if it's, yeah, if you need over the counter, don't feel that you need to come to us. But um, yeah, we're working a little bit more on the education because we do see a lot of people. Like we had a gentleman that was admitted, and he was standing for hours in the hot sun watching his grandson play baseball, and he fainted. And it was just that awareness, like if you're standing for a long period of time, move, go for a little walk, move, sit down, drink water, because that blood flow is just not returning. Because there's, if that calf muscle pump isn't working and you're just standing there, it's that blood's not going back to the heart. So yeah, I hope you guys got some education out of this. And yeah, I'm happy to answer if there's any other questions.
Oh yes, thank you, Tanis. Yeah, okay, so we got a couple in the Q&A here. I got one in the chat box as well, but I'll start with Q&A. We had somebody type in and say, I don't think that I have DVT. A physician has seen my legs, but they are discolored spots on one leg more than another. Occasionally, there are similar spots on my arms, no actual bleeding, but if there was a cut from gardening or something like that, it takes a while to heal. I do wear calm socks. They seem to help, and there
Mm-hmm.
seems to be no other treatment. I don't have visible veins. I think you
Mm-hmm.
just answered one question, wear compression socks for arms. I just wondered if there's anything else that I should be doing other than wearing compression socks. And should one wear them every day or alternate? They're hot in the summer. And again,
Mm-hmm.
thank you for your previous answer.
Oh, thank you. Yeah, so it doesn't sound like a DVT. So that's great that she's gotten kind of checked out. That doesn't sound like a DVT. So yeah, if it's kind of discoloration, like if it kind of looks like something like this kind of redness spots, like it might just be some venous, like if it looks anything like that, it might just be kind of those red blood cells, which I mean might be that there is some the beginning of some venous disease. But yeah, it depends on why you're wearing it, whether you need to wear it every day. So I wear compression socks to work, but I don't wear them. Well, I actually wear them hiking and I wear them traveling, and then I wear them to work because I'm a nurse and I stand for long periods of time. But I'm not wearing them today because I'm sitting and standing appropriately. If you're wearing them for DVTs and you're a truck driver, you're going to wear them on days that you drive a truck. So if it's for DVT, you'd want to wear it on those days that you're high risk. Or if you think you're going to stand for long periods of time watching baseball outside, I would wear it those days. If it's for varicose veins, do your best. Like the more you wear it, the better. But if you think that you're going to have a day where your kind of feet are going to be up most of the day, I mean, the more the better. But I also am very understanding that you don't want to wear them in the summer, and that's fine. I mean, it's better to wear it the more you can, but I mean, it's not going to do a whole lot of harm if you don't wear it that day, if you have days off. Don't be
So
wearing
thank
it to your daughter's wedding on a wedding trip.
Yeah, yeah, give yourself a break.
Yeah.
And I think that speaks a lot to it as well, right? Just making
Yeah.
sure that you're not resenting what you have to do, you're taking
Yeah.
that time and you're
Yeah.
not, oh
Yeah.
God, I hate this, right?
Yeah,
But
exactly.
I did just to add to that then, Tanis, you were talking about a long time wearing them for or standing for a really long time. So what is a long time to you?
Uh, well, I'm a nurse, so 12 hours is a long time to me. But also, I would say if you're standing, like I would say more than a couple hours, if you're going to be standing for more than a couple hours without moving, without walking. So like again, I go back to the baseball, like he probably stood for 2 hours in the sun. So that put him at risk. But there's lots of jobs, there are lots of people that like grocery clerks that are standing all day, or teachers that are standing at a classroom or sitting marking. So kind of if you're doing 8 hours of on your feet or 8 hours of sitting down, the problem with sitting down again, yeah, you just is the same thing as the pump's not working. So that's important to wear, but also important to wear is if you're sitting for long periods of time, then stand up and go for a walk on your breaks. And if you're standing for a long period of time on your breaks, lay down, put your feet up. So just give it the opposite to kind of help drain that and get that fluid out.
Awesome. Okay. Thank you so much.
Yeah.
I got a couple more here. So there's a question that says, do the machines that you can attach to your legs, which are supposed to drain the lymphs with legs above your heart, actually do any good?
Um, so is this in hospital? Can you ask her? So in hospital, maybe just she might clarify with some of this, but so in hospital, people will wear
At
like an
home.
SCD, a sequential compression device, probably. And what that does is tighten at the bottom of the ankle. It'll start kind of inflating, and then it'll inflate up and bring blood flow up. Can you ask her if that's what she's talking about?
So they said at home.
Oh, at home. Okay.
Yeah, and yes. So they just said
Is it the
yes.
same? It's the same thing that she's talking about. So they do.
Yes.
They are effective, and what that is doing is absolutely. So it might not be preventing the edema, but what that is doing is exactly what your calf would be doing if your calf is moving. So everyone on the units that I work on, everyone either has generally a blood thinner, whether they get like tinzaparin, like an actual shot, or they get, if they can't tolerate that because they're going for surgery or whatever the case is, if they're not and they're not up and walking around, they everyone is on that. And what that does is it just does exactly what your calf does, and it squeezes from the bottom, and then it squeezes all the way up, and it moves that blood up and through and prevents stagnation and prevents clots, because people in hospital are usually the highest risk
Mm,
of clots because they're not moving, they're at bed rest, they have an infection, they have some sort of process that's going on that makes their higher risk for clot, and they're not moving. So they do work. Yeah,
yeah,
absolutely.
they just said cuffs that inflate. So,
Yeah. Yeah,
um,
so they move blood from the bottom to the top, and then then that blood's not sticking, it's not stagnant, and then the platelets don't stick, and then it doesn't form a clot. So they are very, very important, and that's why they're either recommended. I didn't know they had them at home. We see them in the hospital all the time, though.
yeah, and I recall seeing them in the hospital as well.
Yeah, yeah,
So there was a question before that that says, do you have any with an open toe? So
we do. Yeah,
okay, yes.
yeah, yeah. So if people are wearing sandals or just have bunions or have, yeah, there are options that have, and there's actually sleeve ones, and you gotta be a little bit careful with those ones of why you're using it, because if it's for swelling, you're gonna swell below where that is. But yeah, there's open-toed ones that aren't that. Not a whole lot of people get them, but if you wear sandals or if you have some irritation, problem is that then if you're wearing them in a shoe, a closed toe shoe, then sometimes you got to figure out if you're gonna have bare toes in your shoe. But for anyone that
Hmm.
wears sandals, or if you have sensitive to toes, yeah, there is that option.
Okay. Thank you, Tanis. And there's another one here that says, how do you know if your leg is swelling, is from a lymphatic problem or a vein problem?
That's a good question. It would kind of depend a little bit on your history, and that's a good question for your physician and to speak, because definitely some people have like lymphedema. So that'd be a question that would probably be teased out by your family doctor or MP based on your history, and then also to kind of what level of compression, or if yeah, what level of compression, if they want you in compression socks. A
Okay.
lot of the benefits too require, depending on who they are, um, will require a doctor's note as well, and then they can specify too on it. Like I think my mom was with Manulife, and hers like needed like the compression level, when she would be using it, what the indication for. So sometimes you do have to, if you've got benefits, get that doctor's note. A lot of like nurses or teachers, if you have nurses or teachers that need them, they actually don't need it. Like their unions have just fought hard enough, recognizing that they don't want to waste all these nurses to go to their doctors when they've just been proven to be beneficial and keep people
Mm,
out of hospital and whatnot. So,
mm.
yeah, that'd be a quite good question, and it would probably be based on history.
Okay. We have another one here that says, I have a pair of cotton Sigvaris, 20 to 30, what is it?
Yeah,
MMG, milliliter?
MMH. Yeah.
Okay. Oh, okay. What says
Yeah.
MMG? But,
Oh, yeah.
yeah, okay.
Yeah.
And they work except for the decorative stripes bother me after a while. Is there an
Okay.
option without the decorative stripes, just plain?
Yeah. Yeah. And so Sigvaris is who we use. And so yeah, there. So I can tell which one that she's in, and so she's probably. There's a cushion cotton one that's really nice that has a little bit of a padded, and it just comes in black or white with no. I've worn those ones, and I tend to agree. Some people love the patterns, and I feel the stitching kind of just leaves marks. But yes, they have a cushion cotton one, and they also have just a Sea Island cotton that are just plain colors, or they have lots of other ones that are plain colors. But in the cotton ones, there's a cushion cotton one that's really good, and then there's a Sea Island cotton that will be a plain color without stripes or decorative.
Awesome.
Yeah.
And someone else asked, I got compression stockings when I got my hip replaced. I only used them for 10 days, but I see they have a date of expiry. Because I only used for 10 days, should I be replacing them on that date, or can I use them for another 10 days when I get my second
Ooh.
hip replaced?
Ooh, interesting. How long ago was the hip? I'm just probably. I've never heard of a compress. I would say if it was in the last like year or two, if it was 10 years ago, I would probably just elastic in general. Like I put on an old bathing suit the other day, and like just in general, elastic loses its compression over time. If it was recently, like in the last year or two, and you've only used it for 10 days and it's kind of been kept in a cool place out of the sun, I would think that it would probably be fine. But yeah, if this was a surgery from 10 years ago and it'll have probably lost that elastic.
Okay. And then just to follow up from the previous, the person who asked about the discoloring and that you kind of touched base on that, said, thanks, not brownish, reddish spotting.
Okay, so I think that's probably something that she'd want to just talk to her healthcare, like her physician, and maybe get a follow up with dermatology or something. Because a reddish spots, I wouldn't say is likely associated with a venous. Like usually it's more like this picture as opposed to kind of single spots. I would think that that's probably something unrelated to venous disease. I would think, but definitely a good follow up for her physician.
Just to be safe.
Yeah.
Okay, and then we have another question that says, when you talk about the stockings for athletes, are they to be worn during exercising or after?
Yeah, it's interesting. The studies show that the benefits come mostly from the after, depending on these are what kind of the recovery socks, but depending on what the activity is. So if I'm hiking, I will wear them hiking for the entire activity because I don't want the achy legs at the end. But a lot of the benefits that the studies are showing reduces the next day reports of how achy their legs is, and it's actually beneficial to wear them after as well. So if you're kind of having back to back, it doesn't necessarily like improve performance. So if you can run 100 meters in 10 seconds, if you wear compression stockings, you're not going to get 9 seconds, but you're going to the next day be able to have a harder workout because you're not going to be fatigued from the legs, if that makes sense. But I would say after, they're generally for recovery, but these ones can be worn during and after. But they're showing that after is probably a little bit more beneficial.
And then I just had a question. So that was
Yeah.
all of our questions in the chat box in the Q&A. So if anybody has a last minute question here, go ahead and type it in while I'm asking my final question. Tanis, I just wondered what the system is for you guys measuring for somebody with compression stockings. How do you guys find that right fit?
How do we measure? Sorry.
Yeah, and how do you
Yeah.
find the right fit for somebody?
Yeah, exactly. So they're depending on which socks they wear, we'll just measure kind of the ankle, the calf, the length of the leg. If they need ones that are above the thigh, like if they're pantyhose or above the legs, then that requires more measurements of the thigh circumference as well as the length of the leg and the hip circumference. So we just come with a tape measure and do those measurements, and then there's nuances of it in that some of the stockings we've learned over the last year that they'll fit really nicely. Some of them just like the cushion cotton just seems to run shorter than other ones. So like if someone's coming in with a short leg, I would maybe adjust it a little bit. But yeah, basically we just take those measurements and then there's a graph and kind of figure out which ones, and then also just do a little bit of enough of a history that we can develop to decide which compression level that's required. And then some socks aren't available in certain compression socks. So measurements and do a history, figure out what compression level it is, and then we just have samples, and so people can kind of feel, because once if you're a 20 to 30, you're 20 to 30. So no matter which sock you wear, it's going to give you that 20 to 30 compression. So then it's just a personal preference. If you're kind of hot and sweaty, this pink one is a Flow Tech. It's a new one they developed. It has really good airflow, moisture wicking. So if you're really sweaty, people like that. If you're like sensitive to certain materials, sometimes that cotton one, or if you're really cold, there's wool ones if you're going to be wearing them outdoors. So just kind of understanding what you're wearing them for and when you're wearing them. So a little bit of a history and a little lifestyle, and then just take the measurements and just kind of help pick which ones are best for people.
I love that. So it's very individual. Yeah, it's like, and
Yeah,
you learn about the person too before you fit them.
yeah,
I
yeah.
love
And then
that.
again, the 15 to 20 is over the counter. So that's something, it's just based on shoe size. So that's kind of walking into your drugstore. And then those ones are just based, we can do an ankle measurement, but those are usually just based on the shoe size.
Yeah, and I mean, would I be correct in just assuming you get what you pay for kind of thing? Is that?
Well, not necessarily. It's just they're just not considered what's considered medical grade.
Hmm.
So, which is fine if you don't need medical grade. Like if they're really just for the kind of for traveling or whatnot, they're still like we provide Sigvera, so they're still like quality. They're just not applying the compression. And so once you need like kind of a specific compression and those higher ones, they're just considered medical grade. And with all kind of medical equipment, they're just the price jumps quite a bit to the higher one.
Awesome.
Yeah. So
Okay,
yeah,
well,
if
we
you
had,
have 15 to 20 is what is all you needed, and you go in, then yeah, it's not the quality isn't it's not a quality. It's just it doesn't have to provide as much compression, so it's okay that it's a little bit cheaper there.
okay, I love that. Thank you so much because I think that was a big question. I mean, for me anyways, right? At
Yeah.
what point do you decide if you need the medical grade ones or not?
Yeah. And that's
Um,
something your physician can also help kind of guide you next time you're at a checkup, is just kind of say, like, these are my symptoms. Do you think there's a benefit of compression socks? You can
yes.
get, I mean, you can get compression socks without a physician, but like if you're questioning it and wondering, that's something you could always bring up, and they might say, no, these varicose veins, like, no, you don't need them. And that would be fine too. But lots
Okay.
of people think you need a prescription. And so you do if you're, um, going to claim it on some
Yeah.
benefits, but not necessarily.
Okay,
Yeah.
so I do have now two more because we got a couple
Okay.
last minute ones in there.
Okay.
So,
Yeah. No worries.
one person typed in the chat box said, one more question. My
Yeah.
apologies. My
No.
partner, yeah, that's what I think. I love the questions, so keep
Yeah.
them
Sure.
coming, guys.
Yeah.
On my behalf, not Tannis.
Yeah. Yeah.
My partner is in his mid 60s and has been wearing 20 to 30 compression stockings for at least 30 years. So
Yeah.
many tests, but they still don't know why he needs them. Do you
Yeah.
know of various reasons that can be tested for beyond the norm?
Um, yeah, that's hard to answer because I don't know what the indication, like why they're telling him he needs to wear them. Whether he might have, like, if he's 60 and he's been wearing them 30 and they've been telling him he needs to wear them, they should also be telling him why he needs to wear them. So I don't know if he's just got like unexplained swelling, in which case he has some lymphodemas. So that's a hard one. Yeah, I'm not sure what test, without knowing, I guess. I think it's very fair for him to go and ask and be like, why do I need to wear these? But I assume it's unexplained swelling would be my guess, but that's a hard one to get too specific on. But they should be able, it's okay to ask your healthcare provider, like, why do I need to wear these? And why have I
Yeah,
been wearing them for 30 years? Because that's a long time.
I think that's a really good answer, Tanis, because I think we tend to just put a lot of faith in our physicians and we kind of take them at their word when we don't
Yeah.
realize or that it's okay to advocate for ourselves sometimes and ask
Yeah.
questions like why? Why do I need to
Yeah.
take this? Why do I need to wear this? So that's really important to advocate for yourself.
Yeah. So if he
Um,
doesn't have varicose veins, it's probably some sort of edema, or if he had some sort of venous treatment.
yeah.
Um,
Well, they just said very swollen, only 6 years, discoloration and numbness.
oh, all of it. Yeah. Without any surgical history. Yeah. So I don't know if he's got, that's a good question. I'm not sure what further tests, if he's done all the tests, what else could be offered. But um, yeah. And so the compression stockings aren't going to cure. I should have maybe been more clear on that. They're definitely not going to necessarily cure it. So it's not like I'm going to wear these compression stockings for 10 years and then I don't have to wear them. That's not, unfortunately, it's I mean, there's some lifestyle factors, like if you kind of lose the weight to stop swelling, then your risk of maybe a DVTs go lower. But if it's kind of for varicose veins, it's not necessarily going to fix your varicose veins. It's going to manage and stop them from getting worse.
Hmm.
So it's not a fix. It's a management and kind of prevention more so than a cure, unfortunately.
Thank you, Tanis. And just two more short questions, just in the
Yeah, for
interest
sure.
of time.
Yeah.
So we did have a question, roughly how much are the socks? And that was actually in my head too, so thank you for asking.
Yeah. So it kind of it really depends. Like every business kind of sets their own um, for it. So I've seen them between kind of I haven't seen many of the 20 to 30s less than 115. That's kind of where we go at. And then I've seen it all the way up to like 205. And it depends on kind of which sock that you use. And then if it's higher compressions or thigh high or waist high, those are a little bit different. And then the higher compressions are a little bit more as well. Whereas the 15 to 20, you can get kind of around 50. But yeah, most of our 20 to 30, we've got priced at 115 with GST for most of them. But yeah, so they are definitely a little bit on the more expensive side, but that usually with that includes a fitting to make sure that they're the right size and whatnot.
Oh, I love that. I think that's big too to mention. Yeah, it's
Yeah,
not just the socks that you get, it's the fitting as well. And
yeah, for
that's
sure.
something to be said for sure.
Because lots of people, if you return, will give you won't have that same pricing as they did their initial time, just because they're not coming out to you or doing the fitting and the assessment and whatnot. If it's the same socks that you're ordering, and it's just a matter of ordering it, often those will be a little bit cheaper. But every business, again, if you when I order them, I can't order for myself. So when I order them, they're $137. So it really varies between, I'd say, 115 to 200 ish.
Oh, okay. Well, thank you so much, Tanis. I got one
Yeah.
last question here. Where do
Okay.
you purchase the arm ones? Can you get them at the drugstore?
You know what? I've never done an arm one. I theoretically have done the course and could, but yeah, Sigvaris orders them, or you can order them from Sigvaris. But yeah, you could check with your drugstore. Um, I could look it up, but yeah, we don't, no one's ever asked me for an arm one. So it was in my initial training because you would need the same thing. You'd need the measuring. So you can feel free to reach out to me. If not, your physician might have a better answer for you or might be able to provide some guidance.
All right. Well, this was an awesome,
Yeah.
awesome session, Tanis. Thank you so much. Just for everybody who's here, I am going to put my email. Sorry, I can't do two things at once. I'm going to put my email in the chat box. So anybody who sees the email, feel free to copy it down. If you want me to follow up with Tanis, I can send your email to Tanis to get you guys in communication. Tanis, before we go, do you want to share your contact information screen again? Feel
Yeah, for
free,
sure.
gang. Take a picture, take a screenshot,
Yeah,
and if you need to reach Tanis, you can absolutely reach out to me. My email's in the chat, and I can hook you guys up.
yeah.
And Tanis can keep giving this great information and keep us safe, keep our legs safe. And thank you so much, Tanis.
Awesome.
We have lots of comments saying thank you so much.
Thank you.
I've got
Yeah, thank
arm
you for
sleeves
having
on.
me.
Oh
Yeah.
yeah, of course. Someone said we got arm sleeves on Amazon. This was
Okay,
an
good. Yeah, we're just not over familiar. Like I said, I've never fitted for one, but it would take a little refreshing. But yeah, for
yeah.
sure.
Someone else said that this was an amazing session. Thank you.
Oh, good.
Such a great session. I learned a lot. So yeah, I just, on behalf of Unison at Kirby and all of our people here today, thank you so much, Tanis, for being here. This was
Awesome.
amazing. I
Thank
like to
you.
do this now. I'm giving hearts out to everybody. And
Awesome.
I see lots of hearts coming in and lots of claps for you, Tanis. So
Amazing.
thank you again. This was wonderful. Join us next week, everybody, as we talk about end of life decisions. So, medical assistance in
Oh,
death and dying.
that's a
So,
good one. Maybe I'll
that's
come to
gonna,
that one.
yeah,
That's
come on.
important too.
You know what? Yeah, register on
Yeah.
Eventbrite if you haven't, or contact me,
Yeah.
Tanis. You got my email. I'll send you the Zoom link. So
Yeah.
we
Sounds
got
good.
professionals coming to talk about that next week. So I can't wait to see
Absolutely.
everybody. Thank you again, Tanis, and
Yeah.
thank you,
No
everybody.
worries.
We'll see you guys all soon.
All right.
Everybody,
Thank
take
you.
care of
Take care.
yourselves. Bye bye, everyone.